Hello, class. This is Matt McNeely. Today I would like to present my informative presentation on secondary diagnoses linked to spina bifida. There are three different types of spina bifida. Myeliomeningocele will be the type that I will be speaking on mostly today, as that's what my daughter Caitlin has. By the time I'm finished, I hope that you will be informed of the most four common types of secondary abnormalities that accompany spina bifida, how they impact an individual's life, and the longevity of that individual's life. An average of 4 million babies are born each year in America, and roughly 40 thousandths of a percent, or 1,500, are born with spina bifida. Of that amount, at least 70% of these babies will have at least one secondary impairment. The question is, do you personally know someone who has a disability? Does their disability affect them physically, mentally? Exactly how does it, or is it both? Do they happen to suffer from both abnormalities? My daughter has had over 32 surgeries and months of hospitalizations in the last 15 and a half years of her life. And she has four of the most common that I would like to talk to you about today. Chiari type 2, hydrocephalus, agnesis of the corpus callosum, and epileptic seizures. Chiari malformation type 2 has different levels of severity also. 1 in 3 individuals born with a neural tube defect will present with mild symptoms, and 1 in 20 will suffer from symptoms that require surgery. This surgery is on the graphic. If you will look, the cerebral tonsils are forced down into the spinal canal, and they have to increase the circumference of the foramen magnum at the base of the skull, and they also have to remove the spinous protrusions that stick off of each vertebrae. That allows more room for that brain stem to settle down in there, and it's not pressed upon. So once they do these things, then it allows the person to be able to breathe properly, for their heart rate to be right, and for their temperature control to regulate itself. Second abnormality would be hydrocephalus, which is there's too much intracranial pressure. There's too much CSF, or cerebrospinal fluid, in the skull. There's no way for it to get out. It can't leave, and so the pressure builds and builds and builds, and it causes some terrible side effects. But shunted, when you receive the shunt, it alleviates the symptoms. It removes the CSF into a different part of your body. 90 to 95% of children born with spina bifida require a shunt. The X-ray on the left, if you'll notice, it's a VP shunt, a ventriculoperitoneal shunt. The proximal, or the top end of the shunt, is in the ventricles of the brain, and that's where it picks up the excess CSF and sends it down the tube into the distal, or the lower end, and there it drops it into the peritoneal cavity, which is actually the lining that holds all of your insides, all of your internal organs. And from there, the excess fluid is processed through the liver, the kidneys, and it's expelled out of your body. Without surgical intervention, you either have a severe abnormalities as far as brain damage, and it can result in death. Agnesis of the corpus callosum, or the absence of, there is no corpus callosum in the brain. It occurs at a rate of 1.8 per 100,000 in the regular population, which is minute. But within those who have spina bifida and other neural tube defects, it's 600 per 100,000, which is exponentially higher. These individuals have a hard time understanding abstract ideas, sarcasm, social cues. Whenever my daughter was young, it took her years to understand that we were just picking. Everything that we say, even to this day, she thinks that we're being serious. She doesn't understand sarcasm. So whenever we say something, we have to be careful, because she believes what we're saying as though it were literal. The corpus callosum contains up to 200 million neural fibers, and they combine the left and hemispheres and allow them to speak and talk to one another, in a sense. And without those, it leaves the individual at a great disadvantage. Like Caitlin will never be able to drive. There's certain things that she won't be able to do, computation, a lot of the higher learning skills, her brain can't talk to itself. It also causes her to have really poor balance. She can't keep her balance. She could be sitting on the bed and fall over. Other disadvantages are difficulty understanding language. It took her years to talk and to understand. Vision and hearing impairment, which she has both. A lack of coordination or balance, which we've already talked about. Low muscle tone, spasms, and seizures, which she does have. When we're talking about seizures, there's different types of seizures. Epileptic seizures are the ones we're going to focus on now. And it's a lot about it is the duration of the seizure. If it lasts 5 minutes or longer, you can have a lot of adverse side effects. It poses significant risks, especially if it lasts more than 5 minutes. And they make Distat, they make a pen that has a medicine in it, and you give it rectally if it lasts over a certain period of time to stop it. It can affect your physical and your cognitive both ways. It destroys brain damage. Generalized seizures, they're the most complicated to treat, and left untreated, they can cause irreversible brain damage, and they can also cause death. Caitlin suffered a 6-minute seizure that presented tonically, which meant she was drawn up. It affected her muscles, and then for 2 hours, she was unconscious for 2 hours. Then they tapped her shunt. They inserted a needle, pulled the excess fluid out. She woke up, but she had irreversible brain damage that was documented by the psychologist and by those in the school system. So it is a very dangerous condition if left untreated. In closing, just to give you a comparison, I believe spina bifida and type 2 diabetes have one thing in common. Both have multiple secondary diagnoses that are directly caused by the primary diagnosis. The actual diagnosis of spina bifida, from that arises all these other abnormalities that happen in utero while she was developing. Too much pressure in her brain from the hydrocephalus caused each part of her body not to form where it was supposed to, or as with her corpus callosum, it never formed at all because there was too much pressure. It couldn't expand. It actually forced her cerebral tonsils into her cerebrospinal cavity. So now that's why she's had to have the surgeries that she's had to have. So all those spina bifida debilitating alone, look, the additional defects, that's what threatens the person's life and their lifespan, the longevity of their life, are the defects and the secondary side effects of having the primary disability. And you as an individual, understanding that when someone tells you they have a specific diagnosis, that doesn't mean that that's where it ends. There are multiple things from anything that you can think of that's a diagnosis, whether it be lupus or cancer, or there are multiple things that can happen to that person and other diagnoses that they can get that stem from it, that arise from it, that cause complications, that even can kill them. But it's not the primary diagnosis. So understanding that can make you more knowledgeable and more empathetic and understanding whenever you speak to someone who has a disability.